I mean, this is very simple, right? Or telling me sports is dangerous. Yeah, it could be, but it doesn't mean we don't partake in it. And so it's the same with these skincare products. And we have people here that can guide you through all this. It's very simple.
Welcome to Beyond Beauty, where confidence meets care. Join us as we uncover the art, science, and soul behind today's most refined cosmetic treatments.
Welcome back to Beyond Beauty, the podcast that explores cutting-edge innovations in skincare and cosmetic medicine. I'm your host, Jean, and today we're diving into one of the most transformative trends in aesthetic care, full face rejuvenation. Forget overdone cheeks and frozen foreheads. Today's best results are balanced, natural, and customized. From botox to bio-stimulators, lasers to lifting devices, including the newly upgraded Thermage FLX. We now have more tools than ever to age gracefully and beautifully. Joining us is Dr. Martin Braun, one of the industry's foremost experts in aesthetic medicine and a true pioneer in full-face multimodal rejuvenation. Dr. Braun, when we talk about full-face rejuvenation, what are we really talking about?
When we talk about the entire face, what we're really talking about is all the parameters of good skin health and youthfulness and attractiveness, which includes color, tone, texture, and tightening. These are the 4 parameters that everyone desires: uniform color and tone, not a bunch of red and brown spots scattered all over from sun damage, nice texture, not covered in acne scars, large pores, fine lines, and tighter skin, because everything's going south as we age. And so these are the parameters that people would like to improve. Often we'll see patients come in and they're focused on one particular spot on their face. I have a little brown mark right here. Until I point it out, do you really think when I walk into a room that people look at me and go, that poor doctor, he has a brown spot on his left cheek? No, they look at you and see, do you look put together? Do you have healthy skin? Does it radiate? Do you glow? Young kids glow when you see them playing in the playground, for example. They don't have a yellow, sallow complexion that traps light. They look healthy. And that's what everyone desires. Who doesn't want healthy skin?
Absolutely.
So that's what we talk about when we're talking about pan-facial treatments and using all the modalities together, including the neuromodulators, skin boosters, and energy-based devices.
So the first line of defense, I would think, would be fillers and Botox. Why not just fillers and Botox?
If we only use, for example, Botox, which is a neuromodulator, we only target dynamic muscle movement. And many people are afraid of looking paralyzed, which of course is unnatural. So if it used in judicious amounts, it gives a very nice look for areas like the frown, the crow's feet, the horizontal lines on the forehead, little bunny lines, vertical lines here, which I call the barcode, which is the bane of many women's existence because lipstick will travel into your nostrils. All this is preventable with low-dose Botox, especially when started younger. We hear many people say this is not true. I've been doing it for over 30 years. It's absolutely true. The younger one starts, the better you're going to look as you age. We're all declining. I just want to decline less rapidly. And so that's what Botox does by softening the muscles. However, after the age of 30, 35, especially if you're slim and fit, you lose fat in the face.
Yes.
That's the volume loss we talk about, and you get the Skeletor look. The healthiest people I know are vegetarian marathon runners, but they truly look ill.
Yes.
I mean, you look like you could be dying. Think of example Matthew McConaughey in Dallas Buyers Club. He lost about over 40 pounds, they say, in order to do that role because he was playing a man who's dying of HIV lipodystrophy, and he looked terrible. So he went from one of the most handsome men in the world to looking cachectic just by losing weight. He looked very ill. And so how do we prevent that look, especially if you're fit? We use some of the fillers. The fillers lately have got a bad name on social media because they were overdone. If you do it properly and simply restore your lost volume, you're not going to change your look. You're just going to look the way you looked when you were younger. In fact, you can even bring in a picture of how you looked when you're younger. We don't have to enhance anything. We can simply restore the volume you lost through weight loss. And this is especially prevalent right now with these GLP-1 agonists. Everyone is taking Ozempic and Mounjaro. In fact, I'm going to be giving a talk on this, on the GLP-1 face, which is known, in social media circles as Ozempic Face, due to rapid weight loss. And so this is completely unnecessary when one uses proper skin-boosting agents and energy devices. You don't have to look like a lizard. It's not necessary.
Could you explain how biostimulators like Sculptra and Radius fit into this strategy?
The biostimulators tell the body to make more collagen. When you inject a biostimulator, macrophages enter the area and start engulfing the biostimulator, which sets off a reaction to make more collagen and hopefully more elastin. We always talk about collagen as the main protein of the skin. Of course, it's important to give structure, but elastin is also important because it allows the skin to recoil. For example, a 12-year-old girl makes the same movements when she smiles or frowns as a 50-year-old woman, but we don't see any lines left after she does the dynamic movement because of the elastic recoil of the skin. So it's very important to keep the elastin level in your skin so we don't get permanent smile lines and wrinkles in our face. And this all comes from using the biostimulatory agents in a judicious manner. You don't get the overfilled look with a biostimulatory agent, unless of course you overdid it, which is, your own choice. And they give very, very natural looks. Other biostimulatory agents that we use in conjunction with microneedling are, for example, exosomes derived from various stem cells, as well as salmon DNA. Salmon DNA was popularized, of course, recently by Kim Kardashian when she had it done, I think, basically on her entire body because it hydrates the skin as well as rejuvenates it too.
Can you speak to the other biostimulators, like perhaps ones that are coming up, like, the new ones that...
Yes, well, some of the new biostimulators that we're seeing now, actually developed in Canada by a company named Acorn out of Toronto, we can use the stem cells from your hair follicles. So a couple years ago, I had the stem cells taken from my hair follicles and cryogenically preserved. The younger the stem cell, the better it is. So I wanted to get them out of my head as soon as possible and into the fridge. And so now they've been frozen, and at this time they're now being grown, and I'm going to receive my own exosomes from my own stem cells, which of course I'm going to use to try to grow more hair on my head. So the field is continuing to advance. And so I will see now whether my own exosomes perform better than other exosomes. This will be very interesting to see for me.
And as well, would you consider PRP to be a skin booster as well, PRP and PRF?
Yes, PRP and PRF are our legacy products. We still use them on a regular basis. Companies are now making these other growth factors, such as the exosomes, the salmon DNA, things like Radius, which you can also combine with PRP or PRF as well. So what I will frequently do is inject my own PRP in my scalp and then microneedle in exosomes after I inject the PRP. So you can do both modalities if you like. So you get stimulation from your own growth factors as well as those from the exogenous exosomes.
So we really have, or you really have, sort of a plethora of modalities that you can use in order to achieve rejuvenation.
Yes, and you look at each person, you ask them about what their goals are, what are their individual goals, and then you give them a bespoke treatment tailored for their, particular concern. What is the extent of your hair loss? How aggressive would you like to be to try to regrow it? How bad is the skin on your face? Do you simply need some maintenance, or do you need, true restoration because there's a lot of damage? So we can tailor the treatments in accordance to the patient's needs.
Now, with energy-based modalities like skin tightening devices, things that treat pigmentation, can you speak to that and how does it benefit full face rejuvenation?
It is nice to also use the heat because the heat stimulates collagen production and we get a tighter envelope. And we are fortunate now that we have several devices to choose from. Canada just approved the fourth generation Thermage machine, which is very nice, okay, the FLX. And that machine is now Thermage has been around now for over 20 years, so it has a long treatment history, and it's very nice to put in deep heat in order to make more collagen using radiofrequency. The other modalities are Ulthera and Softwave, which use focused ultrasound, which is very nice as well. So we have 3 different great devices that we can use depending on the person's facial structure, for example, and then we will pick and choose. Sometimes we will stack them as well. That was popularized in Korea, where they'll do several treatments on one day, because the theory is that 1 + 1 + 1 = 10, so you get a super additive effect. And they might even add a bio-stimulator to the treatment as well, and we are offering the same treatments. You don't have to fly to Seoul, Korea to get a stacked treatment now.
Good to know. With the new Thermage, you mentioned Thermage 4th generation. What is the difference? Like, what is the newest and latest and greatest about this new Thermage machine?
The latest Thermage machine has new tips, which are now indicated to treat the entire periorbital area. We can go all around the eye, including the upper lid right up to the lash margin. And so this is very nice that one can try to tighten the skin around the eye non-invasively.
And that would address crepey skin as well, do you think, or?
That's the whole idea, yes. And you would also, even if you're contemplating surgery down the road to remove lax skin, it's still nice to give the plastic surgeon better skin to work with. That's what people forget about with many of these treatments. I am basically preparing you that if you did plastic surgery in the future, you're giving the plastic surgeon a better flap of skin to work with. Many times when we look at surgery and say that's bad surgery, it isn't bad surgery. The surgeon simply had rice paper thin skin to work with and had to pull it against a bony skeleton, with covered in red marks and brown marks. Of course it doesn't look good. If you start with a healthy canvas, it's going to be far superior outcome. We saw that, for example, with Jenner recently. Everyone raves about her facelift. It is a beautiful facelift, but look at the quality of her skin. The woman had very good skin to begin with. So unless that face is being AI enhanced, the skin quality, I'm very impressed by the health of her skin, which of course leads to better surgical outcome.
Full face rejuvenation. Could you explain to us from start to finish what that process looks like?
Well, it all starts with a consultation and a good complexion analysis. We have a can-filled Visia machine where we take pictures of you that show red spots, brown spots, fine lines, large pores, and ultraviolet damage. It's amazing the UV damage that some people have beneath the surface, and it's quite striking when you see a picture of yourself. The machine will also grade you for your chronological age compared to other people in the population, so you can see where you fall. Like, is your skin damage above average or below average for your given age? And people are quite shocked by some of this, depending on the lifestyle they've led, because a lot of sun exposure, smoking, illicit drugs, poor lifestyle choices, will affect your skin quality. Now, luckily, a lot of that can be reversed and fixed. That's hence the skin rejuvenation that we do. So after we do this skin analysis, we look at the person and discuss the different modalities that we have available for them, whether it be neuromodulators, skin boosters, energy-based devices, medical-grade skincare. The most important thing is that there's harmony and proportion in the face and that you look appropriate for your age. For example, you and I have both been doing non-surgical treatments for 3 decades now?
Almost 3 decades.
Yeah, almost 3 decades. And so, in fact, I have a rule that literally any treatment that's done in the office, I have done on myself, first, so I can experience it before I'll even do it on a patient. That's one of my personal rules. And then I know all about it. And I really like it, by doing these things. And I can look someone in the eye and say, I've had microneedling, for example, with exosomes. exosomes from Korea, for example. And this is what they did. They reduced my redness, they enhanced the healing. I do feel I'm making more collagen. And for a guy who was a ship's physician in his earlier years, I've had a lot of sun exposure, okay? I've had many precancers, and I've been able to subdue all of this and treat it, without leaving any scars on my face by doing these various energy-based treatments, as well as different skin boosters.
So is full face rejuvenation just for, say, people who are later in years, like 50 and beyond?
We frequently get asked that question, could you have to wait till age 50 to do this type of stuff? The answer depends on the person. I see many people in their 30s who had quite a party during their 20s, and so it shows on their face, and they can already start doing many things. We often take younger people and offer them preventative measures. Many people ridicule these preventative measures out there. I see on social media saying they don't work. Well, of course they work. A good example is Patrick Bitter Jr., Dr. Patrick Bitter Jr. He's basically the father of panfacial IPL treatments and subsequently BBL. Dr. Bitter's had over 300 photorejuvenation treatments. So if you do the math, he's had one literally every 4 to 8 weeks of his adult life. And he looks fantastic just by doing a flash of light. It really shows you the magic of light just doing BBL treatments on a regular basis. Now, of course, he's an outlier. I don't know many people who've had a dozen of these a year, but why couldn't you do one with every change of season, or even just do one a year and see how your skin ages? There have been many studies done, for example, if we just look at BBL alone, that it upregulates over 400 genes in your skin to make more collagen, elastin, hyaluronic acid, all the good things that you need, such as fibroblast growth factor, vascular endothelial growth factor to, grow new vessels for your new cells. So all these things are rejuvenated. And when Stanford did this study, they were very surprised to see a 70-year-old woman's gene expression started approaching that of a 20-year-old woman after several BBL treatments. I mean, this is true science, and this has been measured. Over 400 genes in the skin that you would like upregulated, are working harder to give you smoother skin, with more uniform color. Who doesn't want healthy skin that appears younger?
With respect to HA fillers, hyaluronic acid fillers, could you speak as to why it has such a bad reputation right now? And because I know that you use it quite a bit in full face rejuvenation in your process.
Yes, it's really sad that now on social media we see this backlash against hyaluronic acid, which is a completely natural substance found in our body. It is estimated we turn over about 200 cc's, 200 syringes a day in our body of hyaluronic acid. If used judiciously, it really makes the skin look smooth and nice. I think the backlash came from overfilled faces, where people had very large cheeks, very large lips. They did too much. And it's sad. When people criticize those, I always ask them, where is the hyaluronic acid in my face?
Yes.
Like, where is it? I've had it in my face now for over 20 years. Okay, every year I put in a little bit. So where is it? It's actually an easy question to answer. The only thing real on my face is my nose. I've had every square millimeter injected from the corner of my eye circle. Why don't I have bigger eye bags? I'm 66 years old. I should have larger eye bags. Why don't I have a deeper nasolabial fold? Even my lips are done, but I don't make them the size of a woman's lips, but otherwise they would be going in like this. And so these are all little things that one can do. And I've had no surgery, and I've just simply been keeping up with botox, fillers, skin boosters, and energy-based devices to try to tighten as much as I can. I really need a facelift, but I don't want a facelift because I'm afraid it might feminize me. Because quite often, as Arnold Schwarzenegger says, you get the girly boy look, which I don't want. Men are generally rhomboids. We are square-faced. A facelift can triangulate my face, and there's no going back. So, these are things that I know, and so I'm trying to do the best I can without surgery. And I would like to, if I change my mind, give the plastic surgeon or my facial plastic surgeon the best flap of skin that they can possibly get to work on if and when I do the surgery.
Of course. So you feel hyaluronic acid is very safe and
Oh, extremely safe. And the beauty is, in fact, I guarantee my results. I tell patients, they're quite shocked when I tell them this, if I suggest that you do something and you do it with hyaluronic acid and you don't like it, I'll simply dissolve it and give you your money back. And why would I do this? Because nobody ever asks for their money back. They're very happy with their hyaluronic acid because they look very good. And they're absolutely shocked. How did you know this, doctor? Well, because I do it all day. And there's certain things that everybody likes. Like nobody, for example, wants a peanut head. They want an upside-down egg or heart-shaped face. I've never had a woman come in and say, could you make me square-faced? Could you give me an enhanced peanut look? Like, it doesn't happen. And so when I restore those things and remove the peanut head or make the head, look heart-shaped, for example, of course they like it. Especially women, they're very feminine. For a man, for example, when you give them a stronger jawline, they absolutely love it. I've never had a man say, I don't want to look like Brad Pitt. Who doesn't want to look like Brad Pitt? I wish I could look like Brad Pitt. I'm envious of Brad Pitt. I mean, he's got it all. And what does he have? A fantastic jawline, right? I mean, what did Sylvester Stallone have in Rambo? A fantastic jawline. What did Arnold Schwarzenegger have in The Terminator? A fantastic jawline, right? And so that's why these are A-list actors. They have a very masculine, strong jawline. And who wouldn't want that? So there's certain things that we all aspire to. And so when you provide these, people are extremely content.
I've actually seen even like when you fill the temples with HA, with hyaluronic acid fillers, that it actually has opened up the eyes.
Yes,
Seen
that's
that
the
as
other
well.
thing. And it's instant.
Beautiful, instant.
And it's the reasoning is that the orbicularis muscle, which is circular around our eye, which closes our eye, is under less tension when you have some filler here. And so the eye relaxes and instantly opens up. It also has a little bit of a lifting effect on the brow. We've seen it. And you also helps maintain about a 10 to 15 degree cant on the eye. See, what makes a woman attractive and also younger looking is when the medial canthus, the corner of the eye, is lower than the lateral, where you have a little slant like the cat eye. As we age, this becomes horizontal, which is very aging. If you can keep that up, you immediately look more attractive, more feminine, and younger. And that's where the fillers in the lateral aspect work. We also cave in from the side. And people will say, doctor, I'm getting long in the face. The vertical dimensions of the skull have been the same since you were 18. Our face appears to be getting narrower because we lose volume in the periphery, mainly the temples and in front of the ears. Hence it goes out, in, out, in. That's the peanut head. And so it's very aging and certainly not very attractive. And the moment you remove that, you look instantly better. People are actually shocked when they look in the mirror how good they look. And we can already predict it because you went from a peanut to a heart. I don't know why the peanut's so maligned, but nobody wants to be a peanut.
As well, this aging process, or this peanut head, as you call it, can start at a very young age, actually.
Oh, yes. And you see it on some women, especially if they're fit. We call it the temporal fusion line, where the forehead ends. And normally you should not be able to see the bony prominence of your temple here. As well, if you have a high cheekbone, it looks like the Rocky Mountains going across the zygomatic arch here, because this is so hollow and this is now high, which accentuates the hollowness of the temple. And so you, like with hyaluronic acid, takes a couple minutes and you instantly look better with a beautiful heart-shaped face, which provides the V shape on the bottom, because we want this dimension to be narrower than this dimension. So we have the V as well, which we call, the triangle of youth, for example.
What would be the maintenance for this? Like how long would the filler last and how often should they do it?
That varies from person to person, but in general, people will come in for a touch-up once a year. So once you have the face that you desire and you're happy with it, it's very little maintenance with the hyaluronic acid fillers. They seem to last longer than we initially thought. And some people think that's a bad thing. I think that's a wonderful thing. It saves you money. You get some people on social media claiming they last forever. Well, this I've not seen. I mean, if that was the case, I would be out of business if they lasted forever. And so, I mean, mine certainly don't last forever, but they do last a long time. And so I'm very pleased with that because I don't have to do as many injections as frequently. So why not?
How does it go away, Dr. Braun?
The hyaluronic acid is naturally dissolved by an enzyme in our body called hyaluronidase. Hyaluronidase dissolves hyaluronic acid. We can also buy hyaluronidase, okay, the natural enzyme. So if you don't like your filler, or you think there's something wrong with your filler,
Like it's migrated?
or you have too much filler, I can dissolve it using a natural enzyme that's already in your body. So we simply inject the area with hyaluronidase, which dissolves the hyaluronic acid. And let me say a little more about hyaluronic acid. It's basically a starch. It's a gel. It's not a protein. That's why people generally will not react to it. You know, it's a natural substance found in our body, and we can dissolve it with a natural substance found in our body. There's this big concern about migration, which I do not see very much, a few cases a year, considering all the people I do. And that usually occurs from people with very dynamic faces, hypermobile. Perhaps it was placed incorrectly. I don't see this migration phenomena in my practice, at least, the way I see people talking about it like it's a big issue. It's not. And so I want to reassure people that hyaluronic acid has got to be one of the safest things that you can do for your skin. And hyaluronic acid, for example, the non-cross-linked hyaluronic acid is actually the solvent that many of these skin boosters are dissolved in, like the salmon DNA has got hyaluronic acid. As the base it's dissolved in. The exosomes have hyaluronic acid in it. The hydrofacial has hyaluronic acid. So all these things we're infusing and microneedling, the base is hyaluronic acid. Many skin products have hyaluronic acid, certainly the expensive ones, because it feels very nice and smooth. Hyaluronic acid is the gel in your eye. It's the lube in your joint. I inject it in my knees every November before the ski season because it's basically like WD-40 in my knees. I love it to lubricate the knee. And more hyaluronic acid is injected into knee joints across the world than into faces. Much more. That's what people don't realize. That's where we got the idea from. It went basically from sports medicine and orthopedics, into aesthetics. And so it's very commonly used. And so I love it in my knee. It's instant relief, from grinding. So that's another use of hyaluronic acid. So lately, the social media negativity I find is unfounded for this. Okay? And people that are overfilled desired to be overfilled. The injector and the patient did this. A person who's walking around looking overfilled did not fall on a needle in their closet, okay? They actually had someone inject them. They looked in the mirror and they approved of this. So they either have a distorted body image, or, I don't know what to say. They obviously must like it because they're walking around like this. Okay? And the rest of the world looks at it and says, this is horrible, and that's what fillers do. Well, that's not the case, because people like us have been filled for over 30 years now, and, I defy people to tell us where it is. Well, in my case, it's very easy. It's everywhere. The only thing real is my nose, I tell the patients.
But you look very natural.
Well, I think so, and I like it. And without any surgery, I'm very pleased with the results. And the skin quality is better when you combine all these modalities. The hyaluronic acid is hydrating my face. The energy is helping make more collagen and elastin, as are the skin booster.
And the neuromodulators as well. Dr. Braun, for someone just starting out, what is your best piece of advice?
Well, first of all, pick a practitioner that has some experience. Okay, that's number one, because we want a pan-facial approach. So you need someone who's well-versed in the neuromodulators, the biostimulators, whether they're fillers or just skin boosters, as well as the energy-based devices. Because when you use these three things, 1 + 1 + 1 really does equal 10. They're synergistic effects. And then it depends on your age and what are your concerns. What is the quality of your skin? And so we look at it. What is your color, tone, texture, and tightening? And so you can already start in your 20s if you already have some damage or you'd like to beautify your face. Then in your 30s and 40s, there will be photo damage, okay? Because unless you're a vampire, you've been out in the sun. And so we lose collagen, elastin, we get red spots, brown spots, large pores, fine lines, and that can all be improved with various devices. So you make a plan on how you would like to keep up your skin quality, and that takes a few visits a year, perhaps 2 or 3, or perhaps more, depending on the quality of your skin. And I look at it that we're basically a gym for your skin. So you make the personal decision, how well do you want to take care of your face? It's like going to the gym. How often would you like to go? As a physician, if you told me you go once a week, I would applaud that. That's better than nothing. But of course, 3 times a week beats once a week when you go to the gym. Just like if you see me 3 times a year, you'll have better results than if you see me once a year. But some people only come in once a year. Well, that certainly still beats doing absolutely nothing. And we are all going downhill. So I would just like to go downhill slower. I don't want to go downhill on an expert slope. I'd like to go down on a beginner slope, much more gradual. And I've seen it over the years. And when people say these things don't work or these are not preventative, I just laugh. It is no different than telling me a good diet and exercise doesn't work. It's complete nonsense. This stuff works fantastic, and I see it in my patients. I see it in you, for example, someone who's been very diligent with their skincare over the years. It makes a big difference. And the women that I've treated now, some for 3 decades, they walk into a room and they literally command the room with their presence. The other people, if anything, are jealous.
Yes, I agree.
Yeah, because they worked at it. And that's not something you can simply buy and do as a one-off. You've been doing it over the years. Just like someone who's fit means they went to the gym, they did the work. And it's the same with the face. It's no different. You did the work and it shows.
So really, this is for everybody, all ages.
Everybody. And one can tailor a thing depending on your budget as well. I understand, people have budgetary concerns, but there are very entry-level treatments that don't cost a lot of money that one can do. A good example is microneedling. Okay, anyone literally with a job can afford to do microneedling. They can also afford to do a little bit of botox twice a year, for example. You don't have to walk around looking angry with low brows, looking sad and tired. None of this is necessary. And so there's a variety of things that one can do for literally anybody.
And of course, this all starts with a good skincare regime.
Yes. And medical grade skincare is important. If I can give one piece of advice to people, why not just use a physical sunblock, that contains a decent level of zinc and or titanium to block the rays of the sun, as well as some visible light on their face. And if you want, get a vitamin C as your base layer. Every morning, vitamin C, then your sunscreen, your physical block rather than a chemical block, and then in the evening wash your face and use a vitamin A that you can tolerate. But look how much vitamin A is in the product. Many of the brands say they have vitamin A, which is retinol, but they don't give the amount. That's no different than going out and buying a vodka or tequila that doesn't give the amount of alcohol. Companies like to boast how much retinol they put in the product. More than one molecule, I hope. Okay, so some of these, they say they have retinol in them, but they put in 1 molecule of retinol in the product. So they're not lying. There is retinol in there, but an insignificant amount. A good product will tell you whether it's 0.25, 0.5, 1%, for example, 4%, 8%. In the office, we do retinol peels. Very simple. We just put some vitamin A on your face and you're going to exfoliate 72 hours later. Very simple regimen that you can do. Literally nothing goes wrong. And now you have some retinol in your skin. We can also do microneedling, put retinol in your skin. So these are things that have been known for decades, literally decades. There's thousands and thousands of articles on the benefits of retinol on the skin. Yet a lot of people don't use it because they say, well, it makes me a little red and flaky. Well, you're using too much, Like, it's real simple, okay? It's like telling me exercise leads to sore muscles. Well, yeah, it also leads to, torn tendons and ligaments if you lift too much. But that doesn't mean exercise is bad. I mean, this is very simple, right? Or telling me sports is dangerous. Yeah, it could be, but it doesn't mean we don't partake in it. And so it's the same with these skincare products. And we have people here that can guide you through all this. It's very simple. But good skin health, as Dr. Abaji says, takes some effort. If you want to relax, have a martini. The other one takes a little bit of effort, like 2 minutes a day.
What we've learned today is that full face rejuvenation isn't about changing your appearance. It's about restoring balance, vibrancy, and confidence through personalized, science-driven care. The best outcomes happen when we work with your natural features, not against them. A big thank you to Dr. Martin Braun for guiding us through this exciting world of comprehensive facial renewal. Until next time, stay radiant, stay informed. This is Beyond Beauty.